Welcome to the Dr.John Char Holistic Health Show. Today we're going to be talking about a 35-year dream that I had. It's called the Holistic Wellness Center in Hawaii. Now, you know, the public's been mired in a tradition of conventional medicine that uses drugs, non-invasive therapy such as surgery, radiation, and chemotherapy. What are any other options for health delivery? And health has risen to such an alarming rate that many families are finding difficult to afford. The benefits derived from these health programs are getting more restrictive as a cost to run them become greater. Now, 17 years ago, I owned a medical dental software company. And we only dreamed of what we could have done, like voice activation, internet communication, things like that, which is the norm today. And so we dreamed and we dared to have a holistic center in Hawaii. But at that time, the technology wasn't up to speed. Today, everything that we ever dreamt of, everything that we wish we could have, is now in operation. Now it's done. It's here. So what we're going to do is we're going to discuss this, the philosophy and the concepts. Because if we can do that, this could be a tremendous asset to the state of Hawaii. For years, health providers have tried to build wellness centers in Hawaii with limited success. Some of the downfalls were there was a complete lacking of understanding on the philosophical integration of Eastern and Western and European medicine and how these multidisciplines should be used cohesively in assessing the cause of illnesses and its subsequent treatments. Now, we've been doing this for almost 40 years. And as a matter of fact, 5 years ago, I decided to retire from holistic dentistry after 47 years of practice. Because now, when I saw what was happening in terms of biotechnology, we now, instead of having a pipe dream of having this modern technology be able to assess the patient and then find the underlying causes, was now here. We could do that. And so I started doing about, the last 7 years, intensive research in using all the information that I've gathered over 40 years of study and research and was able to put it in a computer. So what we did was we found there was many types of equipment out there that claimed that it could do assessments and different kinds of diagnosis and so forth. Now let me explain about this. Diagnosis is usually done by your doctor, your traditional doctor, because he uses lab tests, he uses the different means of his knowledge base, what he's learned, and also your history, medical history, and he makes a diagnosis. But how many have you have gone to your doctors and found out that within 7 minutes, that's the national statistics, that you have been able to been treated, diagnosed accurately and treated for your ailments that you came in? Well, now we have a computer-based called an assessment program where it monitors you. It can monitor the drugs you're taking to see if there's any side effects. It can monitor any types of therapy you're having and seeing what the status is, even before it develops into a crisis medicine, which is the disease state. And in crisis medicine today, that's what traditionally what we treat, because they use blood tests, urine tests, saliva tests, and you usually have to have the pathology, and then you can find it on the traditional lab tests. But with the event or the emergence of computers, and especially in called the biotechnology field, they've been able to use computers to assess the patient. And the diagnosis is done by only physicians, traditional medicine. So now we call that assessments, and we can access and monitor in the event of oncoming disorders and disease or illnesses before it even manifests itself into a pathology or disease state. So these computers now is so amazing that you can actually see on real time on the computer your status. And it's called real time, means that you don't have to send it out for a lab test, but you still need the lab test to verify what it is. So we're not saying that you should go not see your doctor. We're saying basically you can work in conjunction with the doctor, like supporting lab tests, to be able to find out what the underlying cause of your ailments are. Okay. And this type of equipment that we have, and we have one of the few in the world that is FDA approved not only in the United States, but in Europe, Japan, China, and Canada. One of the very few equipment that is FDA approved throughout the world. And this equipment is so non-invasive, it doesn't require any needles or drawing blood or urine. And what it does, it integrates the healing arts and philosophies and multiple disciplines in one type of assessment. So you can do this scan in the body, the total body, from the brain all the way down to your toes. You can assess the whole body in various systems, medical systems, and you can do that within 2 minutes, because the computer can now assess 50,000 transactions in 1 second. And you can even find allergens at a clip of 2 per second. So that's pretty fast, faster than the human mind can think. Yeah. So after 47 years of practicing holistic dentistry, I decided to go more into research and development. And now we have an actual clinic that we can actually assess the body within 2 minutes, and then also have the doctors look at that if they prefer and see if they actually do have that problem. So you can find out underlying causes for your illnesses. Okay. And the beautiful part about it is it's objective, so it can be documented. And so we're trying to take as much as possible the guesswork. You still need the doctor to interpret it, or some lab technicians to interpret what the data comes out. So that's what the doctor makes his assessment. That's where the doctor uses that for his own diagnosis. Okay. And once you find that out, then what is the next step after you find the underlying causes? You must be able to formulate that into a consolidated, comprehensive assessment, and then come up with a strategic treatment plan. Once you be able to do the treatment plan, then it's pretty well set. Now, the next step is what kind of therapy you're going to be giving. Are you going to give invasive therapy, or are you going to back that up with multidiscipline? And multidiscipline can include alternative and complementary medicine, okay, and dentistry too. Because basically what you're looking at is to see if one of the types of assessment in, say, Oriental medicine also corresponds to the traditional medicine as well as the European type of medicine. So you're taking a multidiscipline of all types of philosophies and blending into one system. And that was a very difficult thing to do, That's why people say they're going to open a holistic clinic or they're going to open a wellness clinic. If you look at that, their structure or the way they have it set up is usually you have one specialist, like a massage therapist in one room, acupuncturist could be in another room, a massage therapist which might be doing different types of techniques in another room, physical therapy in another room, and so forth. So what we are incorporating is learning all the different philosophies and putting into one system where one person can know the integrations of all the different types of approaches and be able to correlate that into a treatment system, a treatment modality, in a treatment. And so those treatments basically can be a combination of the spiritual, the mental, the physical, and the emotional. So now, if you only did lab tests, and we'll always ask you, if you did a lab test, where does it fall in these 4 levels of wellness? Is it just physical, or is it mental, is it emotional, or is it spiritual? And if you only did one phase of that, then you're incomplete, according to the holistic principle. So it's completely, it's not, it has a little variations because with the, say, the traditional approach. Because the traditional approach, you find a symptom, you base the things on symptom, and you match it up with a drug or therapy. But when you say, I'm going to a naturopath or someone like that, if the naturopath just asks you only for the symptoms and give you a natural supplement, it is called natural organic. But none of them are holistic, because holistic covers 4 bases under one system. And that system must be compatible to each other. And it formulates a way of lifestyle. Okay, so now, going back, so once you do the assessments, and it's computerized, then you find out what we call that a total comprehensive assessment of the underlying causes of what those symptoms could be. Then, from that point on, you come out with a strategic treatment plan. Now, the treatment plan can involve many different modalities. As I said, these modalities, you can blend them in with one, and it covers the different levels. This is sort of a repeat what I said. So if you had a wholeness wellness center, would you be able to incorporate all that under one roof? It's like a one-stop place. So let me explain to you what we're talking about, Holistic Wellness Center.